What? Come over here. Come here, tush man. Here, tush man. Oh, you're gonna be in a video. You're gonna be in a video? Yeah, you are. I know. I'm gonna make you a star. Yeah, I'm gonna make you a star. Star of what, I don't know, but hello and welcome to the Pup Mommy, where it's all about the dogs. They come first. So whether you're a wannabe dog owner, a first-time dog owner, or even an experienced dog owner, I'm sharing with you my practical hands-on experience, what I've learned, including my mistakes, in loving, caring, and owning dogs for close to 35 years. I'm a chew toy. I'm a little bit of everything. God. This is a serious video. It's deteriorating rapidly. All right. We serious now. You know, there are two words that cause the most heartache and I think concern for any dog owner. And one of those words is cancer and the other one is surgery. Now, this video is about what to do if your vet has told you that your dog needs surgery. Now, I speak from experience, and you may ask, how much experience? Let me show you. Over my shoulder. These canine surgeries are just from the past 20 years. The pup's name and how many surgeries each has had and what type of surgery are shown on that chart. Anything from what I would call normal, like normal. What's normal? Spay neuter. Then we have foreign body, spinal, orthoscopic. In my case, it was orthoscopic knee. Then we have eye, dental, tumor. And in my case, the tumors were both cancerous and benign with my little Bostons. Now, I will admit in full transparency that I could have put a fully furnished addition onto my house with what I've spent in vet bills. But that was my personal decision. But now onto your quandary. And I got a quandary of my own too, don't I? But no, onto your quandary though. Your vet has told you that your dog needs surgery. And there are questions that you should be asking your vet and then questions to ask yourself. Now, first the vet. Question number 1 should be, is my dog in pain? Question number 2, will my dog die if he or she doesn't get the surgery or doesn't have the surgery? And then question number 3 also, what are my pup's chances of survival if the surgery is performed? What kind of quality of life can I expect? And then also number 4, one of the most important, how much will all of this cost? And now on to your questions. First question you need to consider is, how old is your dog who needs the surgery? Now, some people are going to adamantly disagree with me and say it does not matter. But stick with me. Number 2 question for you is, okay, who will take care of the dog when the dog comes home? And of course, number 3, how am I or how are we going to pay for this? So now you have your questions, and let's go into the answers. If your vet answers, let's say yes, to both questions 1 and 2, your dog is in pain, and yes, your dog will die if it doesn't have the surgery, then there are usually 3 causes for this kind of urgency. The first one being the dog perhaps had a severe accident, maybe hit by a moving vehicle, or sometimes with larger dogs, it can be even a case of bloat, like the gastric torsion and twisting of the stomach. The second reason that falls into the urgent category is usually foreign body. The dog has eaten something that will not pass through the intestinal tract, that will not pass through the stomach, and yes, the dog will die if it doesn't have surgery. And of course, number 3 would be a cancerous tumor, if the tumor, of course, is caught in time. Let's go back to those questions. First of all, how old is your dog? Again, people are going to say, some people anyway, are going to say and be very adamant about it. It doesn't matter. But I'm saying to you, I think Now, it's a balancing act between your head and your heart, because here's a case in point. Many years ago, I lost my 5-year-old Boston Terrier, Poco, to meningoencephalitis, which is and was an incurable inflammatory brain disease. When I went back to the hospital where she died to pick up her ashes, I saw an older woman sitting alone with a Labrador retriever. I walked over to her and we started talking. And she told me that her boy was 14 years old. And I remember that because of the emotion in her voice and the look on her face when she spoke to me. And they were at the hospital for some tests, and she was going to go through with surgery to try and save him. Now, I didn't ask her a lot of questions. I just couldn't. But I could see from her dog that he was not really in good shape. And whether this dog was her only companion and she couldn't let him go, I don't know. But I will say this, I have found in all these years of owning dogs that so many times when decisions are necessary, it's not about you, it's about them and about what you're going to be putting your dog through. And then of course the aftermath. And when they're getting up there in age where their mobility becomes an issue and quality of life, all I'll say is it's a personal decision. But you should take all of this into consideration. Now, going back to the next question you're asking yourself, who is going to be taking care of the dog after surgery? That's also equally important because you know what? It's not only going to be about dispensing meds, like dropping a pill in the dog bowl. You could be changing bandages, you could be applying creams, cleaning wounds, feeding the dog, let's say, through a syringe, having to watch the dog 24/7, and also other special care. And I'm going to give you a couple of examples, like with my late German Shepherd Olympia. Now, she was 6 years old when she was diagnosed by a neurologist that said she had intervertebral disc disease. But with IDD, with this particular disease, what was going to be needed was spinal surgery. Now, would she die without it? Well, no, not overnight. But her condition would continue to deteriorate over a period of time until she became paralyzed. And in this case, the decision I made, I think we both won. I gave the go-ahead for surgery. And between the testing, the surgery, the post-op, I want to say that my bill came to a little over $5,000. But the good part, if there was a good part, was that I had insurance. And for the surgery alone, my reimbursement was about 80%. Not to mention the additional reimbursement for the diagnostic testing, which MRIs can usually go for $1,000. And what was the result? Well, in this photo that you're seeing, she's at home wearing her Help Me Up harness, which was a godsend to help with her mobility issue. And I will leave a link to the harness in the description section. I had to put a t-shirt on her so that the harness wouldn't rub on the staples and the sutures, because she had about a foot-long wide swath on her back and on her sides that was shaved. And it turns out that Olympia was a poster child for recovery. The neurologist had warned me and said, you know, look, just be prepared. She may not be able to go up and down the stairs. She might not be able to get into a car without help or onto a sofa. But Olympia surprised everybody. Everybody with her mobility. She lived another 6 years and she was mobile until the end. So that not only says something about the dog, but what an incredible vet I had, who did an incredible job on her surgery. You can see, really, from between testing and diagnosis, pre-surgery prep, actual surgery, post-op, recovery, meds, Your cost for your dog surgery can easily be in the thousands of dollars. And because it is so expensive, one can have the tendency to wait it out. Especially too if the x-rays that are taken by the vet are inconclusive, and also because blood work and other testing results come back normal. Because I will tell you from experience that not all foreign bodies that a dog ingests will show up on x-rays. Now, I do know that financially, whether you are a single owner or you have a family, when you're told your dog needs surgery, this is an unexpected and unneeded expense that you're facing. And as I've already mentioned with my own experiences, most surgeries, along with, again, the diagnostics and everything that goes along with them, they average about $3,500. And some, as I've indicated, way more than that. And for many people, that's a year of car payments. That's a family vacation. Now, I will say this too. Most hospitals and veterinarians, they do offer what is called Care Credit. It's a company that offers 6 or 12-month interest-free payment plans. And also available to help with these canine catastrophes are pet insurance plans. And I'll leave a link to both Care Credit and to the insurance company I use. I'm neither endorsing it or whatever. I'm just giving you, it's a good thing to have an idea as to what these are. And I've used Care Credit and insurance for, I would want to say, about 90% of my dog surgeries. And it's been a tremendous help. But also keep in mind that if you've just found out that your dog needs surgery and you don't have insurance, then you're going to have to, move your budget around, especially if you've opted to move forward with the surgery, because insurance companies will usually have waiting periods. And of course, there are the pre-existing conditions, just like in human insurance. Moral of the story: learn from my mistakes and also from what I've been through all these years. When you bring a pup home into your home, it should be a lifelong commitment. Because, to paraphrase a saying, your dog may just be part of your life, just a part of your life, but to them, it is called The Gift. It's a video that has over 39 million YouTube views. And so if you are thinking about and getting very serious about adopting a dog, whether from a shelter or from a breeder, whether an adult or a puppy, I urge you to watch this brief video because it will help you really make your decision and give you some things to think about. So again, thank you for watching. Don't forget to click the subscribe button. If you have any comments or questions, please leave them below. If you need any assistance in helping you find the perfect pup for you and your family, my contact information is in the description as well. And so again, thank you.